mental health vehicles, 5,000 more sustainable beds and £1 billion dedicated fund. The story behind the numbers now from Conservative MP and Social Care Minister Helen Whately, who joins me. These are very impressive figures. Thank you for coming on the show. Very impressive figures. How many more staff? How many new staff included? Good morning.
Good morning, Nick, and very good to be on your show this morning and talking about what we're doing to tackle these waits that people are experiencing if they go to A&E or when calling an ambulance, because clearly it's really worrying that if you call an ambulance and it might take longer than you would hope it would. So we want to make sure that people get better care and faster care under the NHS. We're already working really hard on that right now, but today we're publishing our plans for the months ahead and well ahead of next winter, clearly, which includes, as you just mentioned, an extra £1 billion of funding for this part of the NHS, including for 5,000 more staff beds and 800 new ambulances. So to your question on staff, that's beds with the staff covered by that, because obviously the staff is what really, really matters. It's the staff that care for you in the NHS, and the NHS is working very hard recruiting new staff all the time, and we're on track to have 50,000 more nurses in the NHS by 2024 compared to 2019. And actually we've already got 35,000 more doctors in the NHS compared to 2010.
But this particular initiative you're talking about today, what is the number of additional staff that is being sought there or needs to be attracted?
So these beds will be staffed from
but how many
new staff, which are
how many staff per bed? Is it? Do you allow two
recruited
per bed or 1.5 per bed? What is the ratio?
So the exact model depends on where the beds are. So, for instance, different beds, intensive care beds have a different staffing model from beds in normal wards,
right.
And then community wards or step-down beds have a different staffing model again. So that will be part of the delivery of
yes.
this. But what I can assure you is that the NHS is putting in place 5,000 more beds as part of this plan, which are indeed staff beds to look after people.
But sorry, without labouring the point, obviously ambulances need, I would imagine, a 2-person crew. I don't know beds. So and we're getting 800 new ambulances. How many new staff then are being hired to make all this work?
So on the ambulance question and staff for ambulances, there are 3,000 more paramedics coming out of training, graduating from training this year, and more paramedics the year after as well. And in addition, for ambulance teams, we're recruiting more emergency medical technicians who can support the paramedics. So more staff coming into the ambulance services, as well as more staff into hospitals. The other thing I think is really important to say that alongside doing more, which we're talking about here, and more in hospitals and more ambulances, it's really important that the NHS is going to be doing things differently, because we are having more and more people living longer. This is a good thing, but often with multiple health conditions needing more care. So people say, how's the NHS going to cope with ever more demand for its services? Part of that is clearly through doing things differently. So looking after more people at home, preventing people being admitted from hospital if they don't really need to be, and it's estimated around 20% of admissions actually are unnecessary. People didn't need to be admitted, or discharging people when they're ready to go home. And I'm sure you've heard this figure of around 13,000 to 14,000 beds currently occupied by people who have already been declared fit to discharge. So helping discharge people sooner, a couple of things there. One is what we call hospital at home, and expanding that more so that you can have care very similar to what you get in hospital, but have that at home, and also social care, which I'm sure we'll come to.
Yes, I note that you hope to create about 3,000 hospital at home beds. But again, that will put some kind of burden on community nurses or nursing. So how many additional jobs will be created there to ensure that hospital at home beds work and the video link and the medication is all working? How many more jobs there?
So you're right that we also want to see more expansion of community health services, really, really important. So the plan we're publishing today sets out the direction of travel on all of these things. If you're looking for me to give you exact number of doctors and nurses against each one of the things that's happening, that's not something that I'm going to be able to do in this conversation this morning.
But why might
I think
that
what's
be,
really
Minister?
important is to say...
Why can't we say we're having 800 new ambulances, 5,000 more sustainable hospital beds, £1 billion and an extra 7,000 jobs, or whatever the fit? Why hasn't that been worked out?
So there'll be a next stage from the plan that we're publishing
see.
today, which will be the putting it actually into practice in the months ahead. So
Right.
what is going on here is in the autumn statement we announced a historic increase in funding for health and social care, 14 billion more pounds for health and social care, 6.6 billion more for the NHS, 7.5 billion for social care.
Right.
This is spending some of that money on improving our emergency and urgent and emergency care services, and clearly there's a workforce that goes with this. I do want to mention the joining up of health and social care, because people have talked a lot in recent weeks about delays to discharges. Part of that has been a shortage of social care. So a really important part of this plan is coming together, health and social care in every area, working out how much care is going to be needed in the months ahead, how much next winter, both in health and social care, and planning in advance to make sure we have that. So when people are ready to be discharged from hospital, there's a care there for them at home if they need it.
Just lastly on this, I noted the 800 new ambulances will have 100 specialist mental health vehicles. What is a specialist mental health vehicle, Minister?
It's a really good question. So we know that at the moment, some people will call an ambulance due to a mental health crisis, and the ambulance may well take them to A&E, which is not necessarily a good place to be if you're going through a mental health crisis. So the 100 mental health ambulances are specifically, it's a different environment, which is better if you're having a mental health crisis.
What do you mean? You mean inside the back of the ambulance is different?
Inside the ambulance,
I see.
yes.
Right.
With specialist mental health staff, and they may well take somebody to a mental health unit rather than going to A&E. So that's better for A&E. So A&E can treat people who are there, for instance, with physical injuries, and better for those with mental health.
How will the dispatcher know that it should be a specialist mental health ambulance as opposed to what I'm going to term a regular ambulance?
Well, clearly, if somebody dials 999, there's a conversation about what's the reason for them dialing, which in general will help categorise how quickly the ambulance should get there. Something we're also doing is making sure that you've got the right backup in 999 services and actually in 111, which are people are more and more calling when they've got a health problem. Right. And actually having the right clinicians in those services means that you get the right kind of ambulance dispatched or the right kind of care to somebody.
You won't be surprised. I have a couple of other questions, Minister, and I'm grateful for your time. Should someone who breaches the ministerial code be allowed to serve at the highest level of government, in your view?
Well, clearly I think you're referring to Nadeem Zahawi, who was removed from government yesterday by the Prime Minister, who had asked his independent ethics advisor to look into the allegations against Nadeem Zahawi and establish the facts. The Prime Minister got that report, that letter from Sir Lawrie Magnus.
So is it right
morning.
He's gone?
And I think it is right. I mean, the letter from Sir Lawrie was very clear on a number of breaches of the ministerial code, and the Prime Minister made the decision to remove him. Yes.
Explain this to me, Minister. So Mr Zahawi is gone, yet Suella Braverman breached the ministerial code under Liz Truss and was reinstated by Rishi Sunak just days later. So one person can break the ministerial code, but the other can't. I wonder if you can explain that.
So Suella resigned at the time. She apologised for what she had done. And yes, Rishi Sunak appointed her, particularly to focus on one of the 5 priorities that he set out recently, which is tackling the problem of small boats bringing illegal migrants to the UK. Really important to tackle that. I'm sure that your listeners care a huge amount about making sure that we stop those small boat trips across the Channel. With Nadeem Zahawi, Sir Lawrie Magnus was absolutely clear as he set out in his letter several breaches of the ministerial code, very serious breaches, and that's why the Prime Minister removed Nadeem Zahawi from government.
Just referring to the Prime Minister, you'll be aware, Minister, later this week marks his first 100 days as PM. It's a bit of a media stunt, really, but when you look back on those 100 days, we've had one cabinet resignation, Sir Gavin Williamson, one cabinet sacking, Nadeem Zahawi. The Prime Minister himself has had a fixed penalty, and his Deputy Prime Minister Dominic Raab, facing allegations, more than 20 of them, for bullying, and a Home Secretary who was appointed after having to resign. How would you characterise the first 100 days of Rishi Sunak's tenure?
Actually, when I look back on the last 100 days and I look at the things the Prime Minister is doing, like getting inflation under control, which is so important because it's affecting the cost of living for so many people, while of course making sure that there's support for people who are struggling with the cost of living, the direction of travel and the plans for our economy for the future, the focus on education, on training, on numeracy skills, on the things that will grow our economy. And clearly in my job, the focus on the NHS and making sure that we address the things that people are really worried about with the performance of the NHS. I see a government and a Prime Minister working really hard on the things that matter to people.
You don't see a government that's certainly got issues with, or one newspaper says is mired in sleaze. I won't run you through all the resignations and sackings. You just don't recognise that minister.
No, I see a government, as I said, really focused on people's priorities and doing what matters for the people of the country.
And lastly, another anniversary this week. And while I must remind the listeners, you were a Remainer. Subsequently, you have said you think Brexit can be a success. 3 years ago, later this week, the UK actually left the EU. What's been the biggest achievement in that time?
So, as you say, I did vote Remain in the referendum, but both completely accepted the result of the referendum and actually also see the opportunities for the country as a result of Brexit and the different path that we can take. What have you achieved in the
first 3 years? What opportunities?
I mean, actually, one thing that you can point to is our vaccination programme during the pandemic, where we were able to go further and faster and led Europe, if not the world, on our pace of vaccinating people, which protected many, many thousands, not millions of people from COVID. So that's an example of the sort of thing that we can do differently, go faster and better as a country independent of the European Union.
Had there not been a virus that claimed scores of thousands of lives, there wouldn't have been much else to hang the hat on, would there, for leaving? Noting you again you were a Remainer.
You asked me for an example, and that was an example. I think the other thing which we're doing is really important is looking at what regulations that we can remove and what freedoms that we can give businesses, for instance, and science and technology to innovate so that we can be a more innovative country, which is going to be so important for our future economic growth.
Enjoyed our time together. Thank you so much. Social Care Minister Helen Whately appearing here on LBC at 2 minutes after 8 News is next.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom, thousands